Hi, Dr. J here. When you first came into the office as a new patient, or perhaps when you expressed interest in knowing more about the clinic here, I sent you out an email. There was a series of emails that had various videos that talked about a wide variety of aspects of your health and how we approach healthcare at this clinic. One was a video about acupuncture and its history and what it's used for. Another has to do with detoxification, the toxins in the environment, why it's necessary to keep them out of your body. And then a series of other videos that went through things perhaps we talked about, like the Chi body diagram. A number of people actually watched the whole series, but many people apparently didn't get them or didn't get through all the whole series, and then the continuity of that broke. So I am sending it out to you again. Those who unsubscribed obviously are off of here, and if you want to unsubscribe, you can do that as well. But it is a series of a number of emails that are there to help you have a healthier and happier life. That's my purpose, is to help as many people as possible achieve optimal health and vitality and to achieve their goals and purposes in life. So I hope you enjoyed the video series again, and let me know what you think. You could always also sign up for the opportunity to win a free foot detoxification process in the office, which is a $45 value, just by participating in feedback on our clinic. Thanks so much. I look forward to speaking to you again soon. All right, so I appreciate your saying something about the experience you've had related to Alzheimer's.
So I have had plenty of family members in my family. So my family suffers from the history of dementia and Alzheimer's, and it's been really difficult to have to deal with that and learning that beginning process of how the family member starts to show symptoms and how you react and deal with that, because you struggle with constantly having to repeat yourself and go through that process. It gets stressful, it gets annoying, but you have to learn that it's called, you deal with a lot of patients and having to, just reiterate a lot of things that you're saying, make them feel comfortable, because they're just as uncomfortable about not remembering things as you are having to repeat yourself. So dementia and dealing with Alzheimer's is a really scary process, because you're realizing that you're losing your loved one and they're not remembering you, and they're starting to remember things that people with dementia, they tend to remember things that you don't remember yourself, because they're remembering things from the past that pertain to them specifically. They're going pretty much back into time to a place where they're comfortable in the things that they remember. So having to deal with that and learn how they feel and not being able to connect with them, or them identifying you with somebody from the past, can be a very difficult thing. And
So that's identifying you as somebody who isn't even you.
correct. It's somebody that they're comfortable with in their past, someone who they've essentially grown up with. A lot of times they regress back to their childhood days and they experience those things that they remember, like their parents, their mother, their father, and they may associate you with that. And at times it can even blame you for things that you may at one point, they may have gotten in trouble for, and they remember. Simple things can trigger those types of memories, and they'll turn around and blame you for those things, and you have no idea what they're talking about, don't know how to respond, how to reply. So it's really learning how to deal with those things and be able to comfort your loved one and teach and kind of get them through that process, and try to get them back into their own reality, which is where they're currently at.